Hello, everyone, and welcome to Slashdot Media's SourceForge Podcast. Thank you for joining us today. I'm your host, Bo Hamilton, Senior Editor and Multimedia Producer here at Slashdot and SourceForge, the world's most visited software comparison site where B2B software buyers compare and find business software solutions. So today is an especially special episode because for the first time, I am joined with co-host Sydney Shepard from SourceForge. Hi, Sydney.
Hello, everybody.
It's nice to have you here. We're both here today to discuss online therapy and counseling with none other than Albina Galiza from online therapy platform Calmerry. So Albina is a Jane of all trades. She's a business developer. She's an HR and benefits specialist, a quote, social dancer. Might have to ask her some questions about that. But perhaps above all or most pertinent to our conversation, she's a mental health and wellness enthusiast. Now, to kick things off, I would just want to send it over to you, Albina. Would you like to introduce yourself and give us an overview of Calmerry?
Yeah, sure. I'll be happy to. And thank you so much for having me here today. Pleasure to be here. And so I joined Calmerry about 3 years ago. For me, it was life-changing because before I worked with finances and I spent 10 years in finance industry. And during the COVID pandemic, I realized that this activity was no longer aligned with my feeling of purpose. And that's how my journey into online counseling and coaching began at that time. So I felt how impactful it can be to seek for help because before I tried to do it on my own. And for me, joining Calmerry was a personal matter because I don't want anyone to struggle on their own. We need to normalize these kind of conversations, because it's totally okay not to feel okay 100% of times. And a little bit about Calmerry. Calmerry is an innovative mental health solution designed to make quality therapy and coaching a part of people's routines. We make quality therapy easily accessible to everyone. Calmerry platform is available through a web browser or mobile app from anywhere in the world. So far, we have served 38 countries. And we match clients with fully licensed mental health professionals from their states. We offer asynchronous messaging and video sessions. And in addition to therapy support, we also have a suite of tools for reflection. We have guided mood tracking, journaling, self-assessments, a content library of self-help tips and self-help content validated by our mental health experts.
Oh, thank you for that. I really resonate with that first part you mentioned. Mental health, it's really, I think it's finally starting to gain the recognition and importance, but I know it also has a long road to go, especially after hitting a speed bump during the COVID-19 pandemic. So it's my understanding that Calmerry was founded during the pandemic. Could you kind of share with us that story?
Yes, absolutely. You're absolutely correct. Calmerry was launched in October 2020. And it was launched by our CEO and founder. I'll tell you a little bit about how the idea was conceived. So he was at the dinner table with his wife during this time of isolation where people suffered. A lot of our internal professionals suffered at home. So they were bouncing ideas around helping people during these difficult and challenging times. And Alex had previous experience of launching and scaling successful online businesses. And he decided to use his expertise to launch Calmerry and help people during the COVID pandemic. So he had a team of tech professionals. He had a product team. He put all these great people together. And that's how we launched Calmerry with the special focus on simplicity, because we want this platform to be easy, accessible, and easy to navigate. So user-friendly approach is our top concern.
And kind of jumping into some more of the technical aspects of what you guys offer. I'm curious, what is the main way that Calmerry streamlines mental health support for businesses and organizations?
Yeah, so initially we started with a B2C product. And our product team had plenty of interviews with users of different age groups to ensure that the product is easy and cool to navigate. And in 2 years, we launched Calmerry for business. So basically, I'm in charge of B2B space and partnerships at Calmerry. We now offer Calmerry as a mental health benefits to employees, helping our clients to build psychologically safe environment and fostering empathy and support at the workplace. So it's really cool to have an on-demand access to the platform and talk to a therapist whenever employees feel like. So there is no unique approach for each company. That's why we launched this B2B solution with the flexibility in mind. So we offer flexible therapy plans, subscription options, because what works for one company might not work for another company. Also, we offer employers an admin panel with the live dashboards for utilization and engagement reports. We do not disclose any personal information because the end user data is our top priority, so we keep it secure. However, we share the anonymized insights into mental health and workplace issues employees are working through, and it can help employers better understand the mental health trends and maybe offer additional support if needed.
That's awesome. Definitely the security piece also is a big thing these days. So that's great. And what types of like industries or companies do you guys help? Like, is there a specific industry that you guys typically have, clients within, or is it kind of general, like anybody can use your solution?
Yeah, so mental health support is much needed across all industries, but
Yeah.
I found particular fulfillment working with nonprofits and the healthcare sector, because helping
Yeah.
and supporting people who devote their lives to helping others is incredibly encouraging and motivating. I want to share a story of one of my first clients. I was reached out by Terry Cole. He's the founder of the Street Youth Ministry of Austin. And his message still resonates with me. He said, I'm all for covering my employees, like covering mental health for my employees, but it will be earth shaking if we could provide the youth who recover from homelessness with the support they need, and it is digital and can be accessed from anywhere. And he had a specific request because he was looking for a cost efficient way to work with grants. And at that time, we worked only with per user per month model. So we didn't have the opportunity to let employers or nonprofits pay for active usage of services. But for this client, it took some time, but we developed a payment model that allows them to pay for active usage of services without any additional platform fees, missed sessions, like any additional cost, just the conducted sessions. And it was quite a successful case. And that payment model was adopted by other clients of others, mostly those who offer mental health support to their clients. So to name a few, these are Cherokee Nation, the Street Youth Ministry of Austin, as I mentioned them earlier, Bigger Than the Trail, and others. So yes, you can use our mental health coverage programs both for employees and for the clients who need additional support.
Wow, those are some great examples. Thanks for sharing that. Has Calmerry always? I guess you mentioned that Calmerry has launched a B2B platform recently. So they started as a B2C. You guys started as a B2C company. Are you still operating as a B2C company as well?
Yes, so we developed two sides of business. I'm in charge of B2B, but yes, we still have B2C clients. So, and we offer flexible subscription models for those as well. Our clients can work with asynchronous messaging only. They can choose to work with video only, or they can use a mix of both. And also they can access platform, and they can keep reflecting using our mood tracking, journaling, and the content library without no active subscription. So platform is open. You are free to go to the App Store or Google Play and download it and start reflecting, because I personally believe that self-awareness is really important. You know, understanding yourself, understanding your needs, understanding your feelings is crucial for the therapy process. And even when you have used, if for example you're an employee and you used your prepaid balance, it's really crucial to keep checking on yourself. We need to develop that habit and keep checking on ourselves more.
I 100% agree with you there. Yeah, that's something that I'm constantly working to improve myself. And I imagine there's been a sort of an influx of different mental health software platforms, especially since the COVID pandemic. For Calmerry, what are some of the key factors that you'd advise for organizations to prioritize the right fit?
I think that to get the most impact, you need to understand the needs of your employees. So, before choosing a software platform, I would advise to conduct some assessments, surveys, maybe even having one on one session if you feel that you have the psychologically safe environment, and your employees feel open sharing their ideas on the benefits they would like to have. But if we're talking about the evaluating the software itself, I would mention a few factors. One is therapist network. I would ensure that the therapists on the platform are fully licensed, and they are using evidence-based approaches. And I would also ask about how long it typically takes for counselors to get back to their clients, how long it typically takes to get matched with the best fit therapist. I would also consider asking about the utilization rates, because, of course, we do not want to offer benefits that are not being utilized by employees. So I know that an average utilization rate among AP is 4 to 5%. Uh, with Calmerry, from what we see right now, is 10-15%, and we are proud of this metric. I would also
Nice.
consider asking about the account manager and dedicated representatives, because it's great when everything going fabulous, but in case any problems arise, you need to have a person to contact to.
Yeah.
We at Calmerry have mental health care team. We have technical support. We have dedicated representatives the employer can talk to if they wish to somehow supplement the initial package with, let's say, group sessions, additional courses for employees like self-development sessions, coaching for managers. So all is doable. So I would say that flexibility and personalization really matters.
Okay. Yeah. Well, so you mentioned the therapist network where Calmerry makes sure therapists are fully licensed and use evidence-based approaches. Could you just elaborate a little bit more on how Calmerry ensures the quality of therapy?
Yes, absolutely. So we follow NCK guidelines, and only 7.6% of all applications are accepted. We also have a clinical director and case managers who are responsible for the therapy quality on the platform. But technologically, we also use a data-driven ranking system. We launched the performance review for therapists earlier last year, and we score them based on our internal metrics. That includes clinical outcomes, assessing their video session and text-based activity performance metric, time response, and stuff like that. And I also must say that we work with only fully licensed therapists who are licensed by their state boards to provide counseling independently and without supervision. So it means they have at least 2 years of active experience, and an average number of years in practice on the platform is 6.5.
Hmm,
Wow,
interesting. Yeah.
that's a long time for the average. That's cool. It means you're getting someone who's experienced. That's great. And kind of switching gears a little bit, but tying back, you touched a little bit on how easy it is, to go to your app and kind of get started with Calmerry. And we know that, user experience and just ease of use is super important these days. People like to be able to access things quickly and just get started very easily. So what are some of those like guiding principles that shape how you guys design your platform to be user friendly and intuitive for, not only employees, but also the administrators that are using Calmerry?
Yeah, sure. So, as I said, simplicity was our main focus when we created Calmerry. So it's really easy to navigate the platform, to schedule the video sessions. Basically, the end users just see the available time slots of their therapists, click on therapy session duration. We offer 30 minutes, 60 minutes, and 90-minute session. And as easy as that, they send an appointment to the therapist, so they don't have to wait long. They can plan according to their schedule. And talking about the administrators, our admin panel allows to track the return of investments by seeing how the program is being utilized. So we share these live dashboards of utilization and engagement reports. We show how much time it takes for our matching agents to find a best fit therapist for their employees. We show an average metrics on how much time it takes for therapists to get back to their clients, and it is less than a day. So there is time lag in text therapy, but the great thing about the platform that we have this message board, and employee, whenever they feel stressed, whenever they feel down, they can express themselves. They can send a message to a therapist, and a therapist will get back to them with the guidelines during their working time. And they can see the schedule of the therapist. So it's not that they are expecting to get this response right now. We also send reminders about the video sessions, like to ensure that we work with the network efficiently. UX and UI design on the platform is great. I hear that from our clients, and you can schedule a video session with me, and I can guide you through the platform, or you can download it on our app and try using it. So we just try to make it as simple as possible and as user-friendly as possible. And we work with all the age groups. So talking about the demographics, we can see that people with different technical proficiency level can use the platform with no problem. But at the same time, we have the technical support team. So again, if any questions arise, people can always chat with the live agent. and employers can always contact their account managers. So I think it's really important. The same for the therapist. They also have their dedicated managers whom they can talk to whenever any problems arise.
Yeah, that's great. It sounds very easy, intuitive. What's the word? Yeah, intuitive. That's great. And a lot of companies or platforms integrate with other partners and other solutions. So how does Calmerry connect with other tools or platforms that someone using your solution might need to connect with?
Yeah, good question, because I think it's really crucial. I just read an article that 80% of clinical errors happen because of poor care coordination. And what they mean by care coordination, they refer to data exchange between providers. It's really great to have everything in one place with the patient's data. And we are open to use our technical expertise to integrate with partners whose mission aligned with ours. And right now we are working with a single sign-on with Lila. Lila is a benefits collective. They help employees navigate their benefits in the most efficient way. They have a great customer care team as well. And we use this prioritization of the end users user experience, both Lila and Calmerry. And I must say that to partner with Calmerry, it's necessary to meet some technical requirements as well. So we only partner with HIPAA compliant solutions. As I say, we prioritize the end users' data. We take it really seriously. Rather than that, we would like to work with partners who also advocate for mental health awareness, who advocate for diversity, inclusion, equity, and belonging culture. Neurodiversity too, great topic these days, because we are getting better with diversity and inclusion, but at the same time only 22% of companies have policies regarding neurodiversity. And we would like to join our forces with other companies who support this initiative.
Switching gears a little bit, I have a question for you. So we are sort of our own distributed team. I know before we signed on with this podcast, you're visiting us from Spain. Sydney, I know you're in San Diego. I'm in Portland, Oregon. How does Calmerry help keep mental health services running smoothly across multiple locations? Because I know that's kind of the new norm, is everyone's working remotely in all sorts of areas across the globe.
Yep. Our platform can be accessed from anywhere in the world. So we have about 98% of our providers based in the US and Canada. At the same time, many of them are licensed to work with international clients. And I think it's a right time to talk a little bit about the matching process. So yes, we definitely ensure that the client works with the licensed therapist from their state, but it's not the only point we take into consideration. So we ask clients to complete the introductory intake, where we ask them about their counseling needs and preferences, the issues they are working with, the preferred approaches in therapy. And based on that introductory intake, our live agents who are trained by clinical director, they assign the best fit therapists, taking into account all the scores I talked about previously, the issues they're working with, the approaches they're using, and all of that is taken into account, and the therapist is assigned. And overall, I think that technology-based solutions are the great way to support distributed teams, because it's like having a therapist in your pocket. Whenever you are, whenever you feel like, you can talk to them.
Having a therapist in your pocket.
I
I love
love
it.
that.
That's a good way to put it. Yeah. Well, and that's the thing too, is I feel like, employees, people in general, we need continuous support, and we need to have resources just available whenever we need them, whenever something arises. We need to talk through something. I think that's really crucial when it comes to organizations, and the B2B, the service that Calmerry offers. How would you say that your company enables organizations to provide these for mental health, this continuous support network?
Yes, so I must get back to the self care toolbox. So, we don't want to make our clients dependent on therapy, but at the same time, we think that it's really important to develop the mindfulness and self awareness. We need them to learn to understand themselves better. So, Calmery can even be used as a free resource if you use just the self help toolbox on the platform. And I was at HIM conference, and I was impressed with the number of tools and uh, for remote patients care. So we are more and more adapting this opportunity to check on ourselves at home. We don't need to visit clinics or health centers to get checked. And it is a switch to preventive medicine. And we also don't want mental health care to be just a crisis response. We want it to be addressed on a timely manner. And we believe that fostering a habit of daily check-ins is really important. And this hospital at home care model significantly improves the clinical outcomes overall, especially for people who have chronic conditions. So our platform is enhanced with this digital toolbox, and we want it to be available to everybody without active subscriptions. Therapy is the process. Changing your lifestyle is a process, is a continuous work. There is no fast results. So we just want to empower people to get in this journey and become better versions of themselves. And they shouldn't be perfect, but being 1% better than you were yesterday is crucial.
Hmm. Yeah, and just you keep trying, keep working to better yourself. I think is huge, right? Because then if you don't try, you can't get better, and so that's the big thing. It's like you're building a brick wall, brick by brick.
Yes, and perfectionism doesn't help anybody. We need to embrace this experience of failures at time to strive to be better.
So true.
Yeah, totally. We've talked about a lot of the great things that are available through Calmerry and, using your platform, having access to the therapists in your network. And so what happens when one of your clients wants more of all of those great things, and wants to expand, and they need more mental health resources available? How do you guys help your clients grow?
So we have this admin panel, and basically HR professionals or whoever is responsible for benefits in the organization can do everything on their own. So they just log into the admin panel specifically designed for their organization, and they can invite all the users to the platform by simply inputting their emails. That's it. We will handle the rest. We will send them onboarding videos. We will send the information on how to take the best from online therapy. So we can also communicate mental health benefits for employees, because it might be quite challenging to communicate the existing benefits to employees. So we can create personalized content. We can remind of ourselves to ensure that employees are using the program, and we see the positive results, and employers can track their return of investments, because basically we are focused on outcomes. We want people to become better after using Calmerry platform. And if for some reason admins need to deactivate the user, or they are hiring new people and they need to add more people to the platform, that is all doable at that admin panel. But if for some reason they need additional help, they can always contact their account manager, and we'll do the needed.
That's great. Another ease of use case right there. That's great. And a lot of companies are constantly growing, so it makes it very easy for people to be able to add in more employees and give access to more people to use your platform. Love that. And tying back a little, we talked about remote work, a couple minutes ago, and just people being all over the place, all over the world. So that is obviously becoming way more common, like you and Bo mentioned. So how do you envision the role of mental health software evolving as a result over time? Because we know that that's going to continue to change. So how does Calmerry adapt, and what are some ways that you see that going forward?
Yeah, during this podcast, I talk about the COVID pandemic a lot, but I believe that this time has changed many aspects of our lives. I attended a webinar by Esther Perel, and she said that during times of uncertainty, the most important skill set is adaptability and flexibility. And I can totally relate to that. It resonates with my vision, and Calmerry itself was a product of adaptability. And something we do different from big players is we try to be more than a vendor to our clients. We try to be their partner and support our clients in any possible way. So it doesn't matter how they work. They choose for themselves to continue work remotely, or they get back to office, or they use a hybrid model. We are there for them to navigate them with their operational processes. We have a great network of advisors, and I think that technology-based benefits are the best for any arrangement. So having a robust solution, knowing that your employees can contact to licensed therapists whenever they feel like, I think that it will make the difference, and it will make employees feel really supported.
Now, I want to put you on the spot really quick because you mentioned the remote work aspect. Is, in your opinion, as a leader in this space, have you found that remote work benefits employees generally, or would you say there's a hybrid model that's a good balance between the two, showing up in work? Just curious to hear your thoughts.
Yeah, sure. So we stayed forever remote because I believe that valuing the time of employees is really important and it always pays back. So maybe right now I don't have that work-life balance because I can spend more actually hours working, but at the same time knowing that I don't have to spend money on gas to get to the office, is really important. I know that I can take a dance class or yoga class in between, and it really motivates me because I can use that time more efficiently with more benefits for myself.
Mm. Yeah, that's huge. That's another thing too, where it's like the work life balance has really been exposed from the COVID pandemic. You know, when you have this like existential threat, you kind of opens your eyes, right, and makes you reevaluate work, your living situation, and everything else. Now, when it comes
Absolutely,
to
we are different now.
yeah, when it comes to specifically employee well being, how would you say mental health software, the software that Calmerry provides, how would you say it bolsters the tools, the resources, and knowledge that employees need to do their jobs well and be successful?
Yes, so I believe that having a solution like Calgary will make employees feel supported. And we do know that well, it's not a secret that employees who feel supported, they appear to be more engaged, motivated, and business driven. And talking about myself, since I'm working from home and at times I'm losing this work life balance, but at the same time, I feel the importance of the mission I'm working for. It doesn't feel bad at all. But we need to understand that there is this gap in perception of mental well being between employees and employers. And I want to share some numbers. I think I have it somewhere on my computer. I'm gonna read it just to ensure that I do not miss anyone because I was going through Deloitte's well-being at work survey, and there are really critical gaps in perception between leaders and employees. So I will name a few. The modeling gap. So 72% of leaders say they always or often share information about their own well-being with their employees. However, just 16% of workers report seeing this level of transparency from their leaders. So 72 to 16, the modeling gap. The satisfaction gap. 43% of employees are very or somewhat satisfied with their well being benefits, while 90% of the C suites believe they are. Only 2% of leaders suspect that employees might be dissatisfied. So, another one, the care gap. 95% of executives and 92% of managers believe workers would say they care about their well being. In reality, only 50% of employees believe executives really care, and 68% believe managers care. So we see this significant gap, and we see that we need to do more for fostering psychologically safe environment. And I would say leaders need to do more and show some vulnerability to empower people have these conversations, because from what I see, employees still do not feel safe talking about their mental health issues. I even overheard the conversation of a clinician at him's conference. So she was talking about the woman who came to see a therapist. She paid without a pocket model and asked to not keep any records in her patient's card. When the therapist asked why, she said that she didn't want the employer to find out. And it was in California, quite a progressive state. So we we need to do better. I really think so.
Yeah, though there's definitely a ways to go, and that's interesting too to kind of see the the gap, difference between executives and their employees, right? Just the way that they view mental health and what's missing, what's not. Now, in this space, there's a lot of different trends, right? When it comes to improving your mental health, how does Calmerry approach these trends, and how's Calmerry preparing to meet the developing needs of employees at various organizations?
Yeah, so we hear AI, generative AI everywhere in the healthcare sector as well. But I believe that we still lack guidelines on how to use it effectively and in ethical manner. We are very careful with AI. We do not have any AI tools on the platform right now, but we have them in backlog. We need to test all of these solutions to ensure that all works correctly. So we are going to present some additional counseling tools for our therapists, for therapy notes, for creating personalized therapy plans on the platform. So everything that will help them with the documentation on the platform. Another trend is the holistic approach, and we fully support it. And we want to use integrations with other solutions to ensure that people have access to all body, mind, soul services, because we cannot separate health from mental health, from emotional health, even from financial health. It's everything is connected and really important. So we need to take this integrative approach into managing well-being overall.
Is Calmerry gonna introduce in-house AI tools and services, or is Calmerry going to be partnering with an existing platform, say from one of the giants of, I think, ChatGPT from OpenAI, or Google Gemini or Anthropic?
Yeah, we'll be using OpenAI for our internal tools, but it will be available inside the platform. So our therapists from their profile will be able to use all of the tools for, for personalized therapy plans, for taking notes, like for assessing clients' assignments, because we empower them to use protocols of work with specific issues, to give clients home assignments, worksheets, like to make the counseling process as interactive as possible.
Hmm. Yeah, that's interesting. This is an interesting,
Mhm.
especially interesting space to keep an eye on, because I think it's going to really kind of, maybe not revolutionize isn't the right word, but revolutionize the way people learn and educate themselves, right? Because you have this AI assistant, that's a few taps away at all times, kind of helping you quiz and improve your mental health and really anything, right?
Absolutely, but at the same time, I think that the human touch is really important. So we work great together. So,
Yeah.
in terms of customer care, for example, I would never agree to replace our agents with AI. Because like maybe at some introductory intakes and stuff like that, and I know that AI researchers shows that actually it shows more empathy during the introductory intake that the actual humans and primary care physicians do. But at the same time, I think that it's really dangerous to remove real people from the process.
Hmm.
Yeah,
That's great.
that
Yeah.
that totally makes sense. It's cool though, like you said, to use them hand in hand, because sometimes, I mean, when it comes to mental health, obviously technology is just like such a large thing that has, I think, sometimes negatively impacted people's mental health. But this is a very positive, obviously great way to incorporate technology to, make it better. So I like that. I like everything you explained. That's awesome.
Yeah, and having just watched the movie Her, um, seeing the human connection is something that it should never be lost, right?
Yeah.
Yeah, and I watched Atlas last week, so
Yeah, I need to watch that one next.
I haven't seen
yeah,
either.
you
Sounds
should.
like I need to watch both.
Cindy, you gotta catch up with this. Like Her has been making the rounds. I know. You
Yeah, I
said
gotta watch
Atlas,
it.
Albina?
Yes, Atlas.
Atlas. Okay, I gotta
For
watch that. I
Jennifer
haven't seen
Lopez.
that. Okay.
Awesome. Well, Albina, this has been just great chatting with you and, getting to learn about how you guys support organizations and employees and mental health and just your journey on your own. Working in the mental health space is really cool to hear. But specifically for Calmerry, could you tell us where listeners who are interested in learning some more about you guys, where they can go online, and what would be the best way to get in touch with your team if they're interested in utilizing you guys with the organization?
Yes, and thank you so much for that question. So everybody who is interested in checking more about our platform can go to the website calmerry.com. For employees who consider Calmerry as a mental health solution for their employees, they should click on Calmerry for Business, and there will be the form where they can schedule a live demo with me. I'll be happy to guide them through our mental health solution during a quick call. And also, we share educational content on social media. We have Facebook, we have Instagram, we have LinkedIn. I'm also on LinkedIn, so if anyone would like to chat or just network a bit, I'll be happy to.
All right, go to calmerry.com, visit Albina on LinkedIn. We'll have all the links for you in the description. Well, thank you so much for your time, Albina. This has been really, really insightful for our listeners, and we hope to have you back one of these days.
Yes, thank you so much. It was a pleasure.
Thank you guys all for listening to the Slashdot Media video podcast. I'm your host, Bo Hamilton, joined with Sydney Shepard. Make sure to subscribe to stay up to date with all of our upcoming B2B software related podcasts, and we'll talk to you in the next one. Thanks again, Albina.
Thank you. Thank you for doing a great job.
Bye.